Okay, so my name is Indiana Best, and I'm Métis from Alberta. So I'm doing a project in the Master of Public Health, looking at Métis cultural compatibility with the Honoring Our Strengths framework, which is a framework that was developed to outline guiding principles for an adequate continuum of care, working to implement culture and involve culture in treatment options for problematic substance use. So I'm looking at the Saskatchewan population. So this national framework was created in 2011, and it was had a focus on First Nations and Inuit people of Canada. So there was an obvious gap in knowledge on the Métis perspective. Subsequently, they created the Native Wellness Assessment, which is a measurement tool that clinicians and service providers can use to assess, measure the effect of cultural interventions on a person's wellness as well as their treatment options. So when people are in treatment programs, they can use this Native Wellness Assessment to kind of guide where they're at and how they're doing. And I'm using it from a strengths-based perspective. So my framework and my project is going to be geared from a two-eyed seeing approach. So a two-eyed seeing approach levels a Western view of medicine and also an Indigenous view of medicine and wellness, and kind of uses two, looking through both at the same lens, the same equality. So not emphasizing Western medicine, which is what is seen today in medicine. So it's going to allow Métis community members to also set the direction. So I'm going to go and ask Métis elders, talk to Métis elders, engage them in developing the research questions, engage Métis community members, and asking them what their quality of life indicators are so that I can properly assess what they feel is important that we should address. So I'm going to evaluate the cultural compatibility of the Honoring Our Strengths framework with Métis culture that the elders and the community members gave me input on. And then this is going to provide policy changes and recommendations for both the Native Wellness Assessment as well as subsequent Honoring Our Strengths framework. So if they renew the framework again, it will include Métis individuals. And then as well as provide, I didn't have it there, as well as provide cultural resources, so to a center called MAXI in Saskatoon, which is the Métis Addictions Council services, and that will really help to build capacity and build the competency for Métis individuals so that they can seek adequate care that's culturally relevant to their culture. I'm done.